52-year-old woman suffered a finger fracture during a fall while traveling. She received surgery using a wire to fix the broken bone at another hospital. Unfortunately, X-rays taken upon her return home revealed the initial surgery wasn't successful. The wire wasn't holding the broken bone in place. This can lead to pain, swelling, and limited movement. She came to the Upperlimb clinic, renowned for its expertise in upper limb orthopedic surgery. For a consultation, the clinic recommended revision surgery to properly fix the fracture. Dr. Agrawal performed a minimally invasive revision surgery using a special technique called WALANT. This means the surgery is done with local anesthesia, allowing the patient to stay awake and comfortable throughout. Additionally, no tourniquet is used, improving blood flow to the area. The innovative WALANT technique offered several benefits. The patient experienced minimal pain during surgery and was able to move her finger freely right away. This immediate movement helps ensure proper healing and function. Thanks to the expertise at the Upperlimb clinic and the WALANT technique, this patient is on the road to a full recovery with improved finger function.